Dear colleagues, thank you for joining once again for the third round of our OncoAlert roundtable discussions. With the current situation we're facing globally with the COVID-19 pandemic, the OncoAlert network has taken the decision to bring the scientific community a little closer. Through these roundtables, we share what we know about COVID-19, especially regarding our cancer patients and the danger our colleagues put themselves in treating those infected. However, we felt that it was necessary to shift focus today. As you might have noticed by the title of this roundtable, we wanted to focus on the healthcare worker side of COVID-19, especially regarding the difficulties in the front line that maybe are not evident and other factors that may come into play on a day-to-day with dealing this pandemic. We will dig a little deeper and we'll discuss the physical and mental and emotional stress that our healthcare workers are dealing with, in this particular case, our colleagues, and how these interactions, how the changes on how we used to interact with our patients have affected us, and of course, how we interact with our families. To wrap up this roundtable, we will hear from our dear friend and OncoAlert colleague, Cristiane Bergerot, from the City of Hope Cancer Center in California, and she will talk to us about dealing with the stress. Felipe?
So what we aim to achieve, just a moment guys, I hear myself here. Okay, so our delegates are our stakeholders and represent some of the countries hardest hit by the pandemic. We will discuss these key issues that plague our healthcare workers and even give our own personal accounts of how this has affected us physically and psychologically. We especially want that our younger colleagues out here, especially those in the front lines, know that they are not alone and that all that feelings are expected with the current situation. However, we would also show that there are steps that one can take to help relieve the mental stress when one is not at the hospital, and is the reason we gathered this amazing panel today. So our esteemed guests today in the roundtable are Katrhin Heinrich from the University of Munich in Germany, Cristiane Bergerot, PhD, psycho-oncologist, Sister of Hope from the United States, Matteo Lambertini, MD, PhD from the University of Genova, Italy. We have also Narjust Duma, MD from the University of Wisconsin, United States. We have Punie, MD from UZ Leuven in Belgium, Ben Westphalen, MD, PhD from the University of Munich in Germany, and we have finally Meis, Omran, MD from Karolinska in Sweden. And the co-hosts today are myself, Felipe, Ades, and Gil Morgan.
Thank you, Felipe. I will be moderating this roundtable. The roundtable will be divided into 3 segments of 20 minutes with discussions. The situation in the front lines will be the first one, what our colleagues see as the biggest problems. The second would be how treating COVID affects physicians, both personally with mental and physical stress. And we will wrap up with how to deal with the situation. And here, Cristiane Bergerot will talk to us about ways to relieve the stress, and then I will give a short explanation of something that's called Balint groups, and then we will talk about own personal ways that we can recommend to help with this. After giving our final thoughts, we will wrap up the transmission. We estimate that this transmission will be between 60 to 70 minutes, and we really hope that you enjoy it. So with that being said, let's get started with questions. So starting with number 1, what do our colleagues think is the biggest problem in the front lines? Matteo?
Hi, Gil. Thanks for the question, and thanks to our colleagues for being here. So coming from a country, Italy, where that was the first country to face this very difficult situation and this emergency situation, I can say that the safety of physicians has been and is currently being quite an important issue, because I have to admit that we were kind of not really well prepared to face what we had to face. So like the first weeks, especially in the first weeks, we had kind of shortages of AFP. Like a practical example, I had to use, for example, the same surgical mask for a week because we actually didn't have the chance to have a new one for a while. So, I mean, this is something very important to protect ourselves as well as to protect our patients. So for those people living in country that have not started to face this difficult situation yet, my main advice is to kind of be prepared also in terms of PPEs. And then something else that we really have and we are still facing is the major problem of a lot of units that are turning to be COVID dedicated units. So a lot of physicians are focused on the care of COVID-19 patients only. So less people are available to cover the actual shift, for example, in the internal medicine department. So many oncologists, as myself, are now dedicated also not only to our activities as medical oncologists, but also to cover shift in other units, with a higher risk, of course, to get infected and to expose ourselves also to this infection. And unfortunately, a lot of colleagues have been affected by the virus, and so again we lose people, less people that can work, and more shift coming in. So I think that the main message, if I can from my perspective, is to kind of try to get as prepared as possible to this situation.
Thank you very much, Matteo. Katrhin?
I think one of the main differences to normal medicine we usually practice is that we are now working in personal protective gear, which not only changes the way how we work, but also how we interact with patients. Because usually as oncologists, we try to be as open as possible and be as close to our patients emotionally as possible. And now we're having to protect ourselves and other patients. And we're working with masks and glasses, and we just look different. And I think every interaction we have with our patients is affected by that. Not only that it's physically straining for us to work in this, it's exhausting, it's warm, you cannot breathe right, so it's physically straining. It's also emotionally difficult. Just when you have those patients who are pretty much healthy when they come in, only affected by COVID, and then they're rapidly deteriorating, and you have to discuss difficult decisions with them, like you have to go to an ICU, you have to go to intermediate care, and you just have to do this in full protective gear. That's a whole new level of talking to patients, and there are no relatives you can bring on the bed. You have to do this all by yourself and the patients alone. And I think that's a new level of physical and emotional stress that's come into patient-doctor interaction. And I think that's something we definitely need to bear in mind when we're working on those wards. Yeah.
Thank you very much, Kat. Just a question for you. Do you think that this is something that having all that gear on actually affects the patient's psychological stress?
Yeah.
I can imagine that being there with, if you take a cancer patient, which is already facing a tough situation, now add on top of that a doctor coming in with full protective gear, I can imagine it would be quite different.
Yeah, absolutely. I get the feeling that whenever I enter a patient's room wearing full protective gear, they're so stressed out they cannot think clearly. And when we have patients that deteriorate and they have trouble breathing, I have the feeling when I go in full protective gear, it's getting only worse, because they see me, they panic, and I think it's adding to the stress of the disease, is seeing everybody around you working in protective gear, because it's scary. I think we look scary to our patients right now, and that's definitely straining on the relationship between patients and doctors. And I think it's very difficult to embrace that and bring the relationship between patient and doctor to a normal and healthy level again.
Absolutely. Thank you very much. Cristiane?
So yeah, first, thank you for inviting me to participate here. It's a really nice discussion. I would, if I can summarize at least like in the most common problems of these kind of situations, I would say the highly contagious nature of this virus with a potentially increased risk of death. And I will also say about I will also mention the consequence change in our lives and in our behaviors, as Katrhin said, and also Matteo. I think it has changed everything in our lives nowadays. And I will also include the fact that people are in panic, and they always come to us with a lot of questions, and most of these questions we do not have any answers for them. And it's interesting because we are also people in panic, and we also have a lot of those questions that everybody's asking, and for them, and we are really trying to answer for them and for ourselves too.
Thank you, Cristiane. Ben?
Can you hear me now? Sorry.
Yes.
So yeah, thanks for having me. Maybe following up on the point just made, I believe while being in panic, this situation is also defined that we have absolutely no idea what we're doing. We've all been hit so hard by this pandemic, and there's essentially intensive care medicine that we can practice, but we have no idea how to actually treat these patients properly. And we see so much information coming out. Everyone is jumping on new drugs, new ways of treating people. Twitter, all the social media is flooded. Everyone jumps, and there's a lot of actionism, actually, people trying to push ideas that they heard about. And I believe that creates a lot of stress, both for the caregivers that are actually treating the patients. If every morning attendings come in having read a lot of new papers focusing on new ideas, how to change management, and there's no clear course how to actually proceed. And this is so different to what we as oncologists usually try to do, to treat patients based on evidence and the best data available. And now it's just a jungle of ideas and as I said, actionism. And I find that very stressful, how to manage this situation properly, both on treating these patients, not so much my business at the moment, but also how to take care of the cancer patients that are still under active treatment, how to protect them properly. I find this extremely stressful, and we're not there yet that we can give good recommendations, I believe.
Great point. Thank you so much, Ben. Kevin?
Yeah, thanks for having me on this roundtable. I agree with Ben that actually it's a very difficult situation how to deal with our oncology patients not affected by COVID during this pandemic. We all rely now on telephone consultations. And my general feeling is that for regular follow-up situations, especially in early disease settings where you have a very good bond with your patient, it goes quite well. And I felt during the first weeks we had to do several calls of cancellations that patients were really willing also to shift towards this type of follow-up temporarily, and I have the feeling that it goes quite well. But of course, for a lot of more complex issues medically, I personally feel that it's very more difficult to deliver the quality of care that we want to deliver to our patients, that we are used to deliver to our patients, and that our patients are used to receive from us. And I think there are large differences in the extent to which this hampers the quality, and especially in discussions like progressive disease in metastatic setting, when you're always used to discuss this with the patient together with this caregiver, it's a total different situations when the patient sits on their own in front of you. And also related to what Katrhin said, I think we have to know that even when you don't have to wear full PPE during this conversations, sometimes on real consultation, only the mask can make us look scary. So I think that's really something we have to consider, that's more difficult towards our patients. And also talking to patients with masks, in my feeling, it's a totally different situation. So I think that's a struggle for all of us for the moment. And next to that, all the things see as problems in the front line, I think that all these things are unknown things and new things. And generally this unknown issue is very difficult to cope. We have to give up our structure. And I think that new structures can always imply negative predictions and negative impact on the efficiency, which has a large impact on work efficiency and also on how we feel comfortable with what we are doing. So I think that's one of the main problems for oncologists during this pandemic.
That's a great point, Kevin. NJ?
Hi, everyone. Thank you. So in my cancer center, we're required to wear a surgical mask and a face shield for all face-to-face encounters. So I haven't found to be very difficult with patients English is not their first language, and this can apply to other countries in which immigrants, the language that is spoken in their country is not their first language. A lot of people, and myself included, we use a lot of lip reading sometimes in the context of which the conversations happen. So like hand gestures, which are now very limited, like I tend to be in a paralyzed position when I'm just moving. So that had made it very difficult for particularly these patients. So I think for people who may be hearing this, I think just to take extra little measures for non-English speakers, because they're very scared to come to the doctor without a pandemic, because several aspects like immigration and many other aspects. So what I have done is I call in a little bit ahead of time, if it's possible, and tell them I'm gonna wear a mask and I'm gonna wear a shield when I see you. So that kind of the anxiety decreases. We need to be honest, coming to the oncology clinic is not our patient's favorite activity. So that's already follow anxiety. And for older adults, I'm a thoracic oncologist. So most of my patients are about 60 years old. Hard of hearing, like they're hard of hearing. So then you're talking through a face mask and then a shield, and they're very hard of hearing. So what I have found is that I'm writing things, showing it to them, not giving them the paper, because then they're keeping a paper from the doctor, and then that's a vector. But I'm writing things as we speak, and that has helped, because hearing problems are very common, and they don't want to say they don't hear sometimes because they feel maybe shy to say, I don't understand you, or I couldn't hear. So that, I think that's a little pips and one of the unique challenges that I have been trying to overcome. Also, I always remind them to turn up their hearing aids, and that has been successful so far.
Thank you so much, NJ. Meis?
Hello, can you hear me now?
You're on.
Yes, thank you. Thank you for having me. So we're seeing a drop of patients who are usually seeking our emergency department and oncological part because they're scared of getting to the hospital. So that's one thing that worries me. I mean, where are those patients who we normally see a couple of every day? The other thing is that what happens after the pandemic is over, when we have a lot of cancer patients who maybe had delayed operations, they missed treatments, and I'm thinking that we're going to have a second wave, of course in the pandemic as well, but also due to delayed treatments. And I think we'll have a marathon coming up soon.
Yes, I'm afraid that's probably something that is undoubtedly going to be happening. Felipe, do you have anything to add? How's the situation in Brazil?
Okay, so the situation is really becoming really bad now in Brazil, because the pandemic started later in here. in the Americas, especially in South America. The curve is starting to increase now. We're starting to see lots of cases, and unfortunately, we see most of the cases, not unfortunately, but for a structural situation in Brazil, we see most of the cases in private hospitals and in the doctors. So there are lots of people in my team that tested positive. We had already colleagues in our hospital that died out of the disease, and now we think we're going to face the worst time is when these epidemics go through all the population. So it's very important for us to hear experience from our colleagues in Italy, colleagues in Spain that we heard a couple of weeks ago, and from our colleagues in the United States. Things that you have been through, we're going to go through now. So we hope as medical society here in Brazil that we have learned the lessons that you have to teach us from your experience in the past. So discussions like this are very interesting and very useful for us in Brazil.
Thank you so much, Felipe. And just as an addendum, you just touched into something that was the reason that we started off with these roundtables. And of course, the reason that we wanted to do this one, with the original roundtable, we had very little information about what was happening. And that's when Daniele Generali and Giuseppe Corigliano were able to step in and talk about this with Axel Grothe and Erica Hamilton and Lena Sharp. And that kind of set the groundwork. But now we were noticing throughout, especially because we were collecting questions while we were forming these roundtables, and there was a lot of physician stress that you could tell was behind every single one of these questions. And of course, that made us very worried, and we got the feeling that there was a lot of colleagues out there that are bearing a big burden on their shoulders. And of course, we needed to point out that this is a problem and we address it so that we do something about it. So with that being said, we can move on to the second part of these roundtables. And this is, how does treating COVID-19 affect a physician's mental, physical well-being, not only at the hospital, but also in regards with family life? Matteo, would you like to start on this one?
Yes, thanks, Gil. Yeah, on this point, I think that, as I've mentioned earlier on, from a physical point of view, we are kind of forced to do more actual work as we were doing before this pandemic. I have an academic position, so in theory, I will be supposed to have at least 2 protected days per week for my research and academic activities. And this is, of course, not the case anymore since the start of the pandemic. I'm on shift every day. And then also the shift in the internal medicine department, so something that is not actually my job, are actually increasing, and I have to take more of them. But I think that it's not, I mean, this is our job. I love it, so it's not a problem. We're in an emergency situation, it's fine. But I think what it's more kind of painful to me is from a mental point of view. I think this is a very stressful situation because we feel to be constantly at risk, not only ourselves, but also, of course, our family member. And this is why, for example, I've decided since almost a month from now to kind of living somewhere else as compared to my family. I'm not seeing my daughter and my wife almost for a month now, and probably it's going to be the same for another month at least. So I think this is, and a lot of colleagues of mine have made the same decision because we are really at risk of taking and getting this infection. So I'm really looking forward to know what Cristiane has to say in terms of tips on how to deal with this situation. And I'll be happy to share a few personal views on this perspective. But I think this is the mental point of view, I think, is the most stressful, and this is something we have to really take care of, because it's not only working every day with the challenges associated with the risk of getting the infection, but it's also like listening about the infection all day long, like going back home, talking to your friends, your family member, watching TV, social media. It's only about COVID-19. So, and then you live maybe by yourself, as in my case. So it's kind of, my life is COVID-19 plus cancer care in the last month. So this is very hard to cope with. So yeah, I'm really looking forward to know what Cristiane has to say on that.
Thank you so much, Matteo. Matteo, just a quick question. I know that you're working in Genova, which is in the north, to the eastern part of the north. Have you talked to any of our colleagues, for example, in Milan, in Verona, still in the north, but a little more inland? Are they facing a different situation, especially regarding the stress, or is pretty much, is it a shared feeling among most, I say young oncologists, because I take it the majority of young oncologists right now are probably in the front lines in the north of Italy. Am I right?
Yeah, that's the case. We did indeed a WhatsApp group with the other young colleagues all over the country to kind of manage the situation and all the challenges associated with the situation. But actually, most of us, especially in the north, are actually facing the same kind of issues. Of course, there are some hospitals that are still more protected than others in terms of also on access for patients with COVID-19 or need to take care of patients with COVID-19. Like my hospital in Genova is the regional hub for the management of these patients. So of course we are the hospital in the region with the highest amount of patients. And so we are maybe more forced to take care of this patient population, even though it's not even though I'm a medical oncologist, it's not my main skills and work. So there are other colleagues that maybe are a bit more lucky on this sense, but most of us are facing the same challenges, especially on the family side and on the psychological side, which is, as I mentioned, quite painful.
I can imagine. It's of course nothing like what you all are facing in the north of Italy, and of course have faced. But all of us that especially have a spouse or are in a relationship with somebody who's also in the medical field, it's tough, and it's having to think. But your situation is it's completely different. So really, I can just imagine the stress that you and your colleagues are going through. NJ?
So what I'll have to share is how the phases that I experience, and some people may have feel the same. So I think there are phases of grief, and I think as a physician, I have phases of COVID-19, if it has a sense. Like the first phase was like, oh, this is happening, we need to get ready. So it was like 24/7, go, trying to get ready. And then when we start seeing cases, like this is happening. So I start having some coping mechanisms. At the beginning, I have to say some of them were not healthy. Some of them included drinking wine and watching trashy TV. That was my thing for a few days. But as any coping mechanism, right, they cannot run out. So I have to dig into a little bit strength and finding better coping mechanisms, because otherwise it wasn't, I cannot keep drinking wine every day. I can, but I shouldn't. So the point is that I have found different coping mechanisms. So I take walks around my block, in which there's not a lot of people around, if it's possible, if I'm not in the hospital. I think taking walks and finding things to cope. So I have found writing to help me and to be healthier than watching TV and drinking wine. So that has been very helpful to put things in writing. I'm a thoracic oncologist. Some of my patients cannot wait. So every day is a decision. I was like, are we going to start chemo? You're at stage 3B. If I wait until all of this happen, which can be 8 to 10 weeks, that's a lot for a lung cancer with a 3B disease. So I think finding a coping mechanism that works and makes you kind of feel a little bit productive, I think that's where writing has helped me. I still drink wine here and there. I just want to be clear. Some of my friends have started cooking. My father never cooked his entire life. He's currently in quarantine for 10 days, going nowhere. He started cooking now my father is a doctor as well. So it took a pandemic for my father to start cooking. So that's his coping mechanism. So I think finding that, because the stress is so high, try to balance it out, and has made me be a better doctor because I'm less exhausted in the morning. And when I have to talk to all patients about, yes, we have to start chemo, I'm sorry, you're so afraid. And yes, there's brain metastases. We need to find a way to treat this because we cannot wait for everything to be over for a metastatic symptomatic brain metastasis. So I would like to hear what other people have done for their coping mechanisms and we can learn from each other. That would be great.
Thank you so much, Andrew. Katrhin?
I think an important point is what Matteo already said. It's so difficult right now to split work from private life because everything's just about COVID-19 everywhere. Everyone's affected, the family's worrying, the friends are worrying. Everything you're talking about is COVID-19, and whenever you open your mobile phone, your computer, it's always COVID-19. And I think that's something that's really, really stressful because usually everyone, I think, is trying to leave work at work and go home and try to like calm down and let the day pass and do something nice. And that's just not really possible because it's affecting like every aspect of our lives. When you go shopping, when you go out, it's all different. And I think that's something really, really difficult. And what I found really helpful is doing sports. In Germany, we're allowed to do our outdoor sports activities. So I've been like cycling as much as I've never been before, actually, because I find when I like physically exhaust myself outside, it's in beautiful weather, it's just like free for just like 1 hour, and that's really helping. And for the cooking, I'm like a huge baking fanatic, and I'm baking like every day. So there's like cake in the whole flat because when I'm after night shift or something, that's like a productive thing I can do without watching news or reading anything. So I think that's like the COVID-free time I need to like go back to work in the day after. So I think that's, yeah, my way of dealing with this.
Thank you, Katrhin. Katrhin, quick question. Just when you were talking about the stress and de-stressing, what is the biggest source? I mean, I know, I guess a lot of us working or us that are in physicians and hearing from our friends, but maybe there's a lot of viewers out there that are not physicians. So just if we could give them just an insight of what is it that gives you the most amount of stress, psychological stress, when it comes to this COVID-19?
I think for me, well, first it's that what was said in the first round is we're not really knowing what's going on here. So in Germany, we see the reports from other countries and it's really bad there. And here it's just like getting there, but it's not as bad yet. So we're always waiting for something bad to happen. And that's really, really straining, at least for me. And I think it's the first time since I've been doing that job that it's involving my family. So it's usually I'm working with cancer patients, and luckily enough, my family has been spared from cancer so far. But right now, it's a disease that can hit everyone in my family, in my social surroundings. And I think that's, at least for me, those are the two factors that are worst: waiting for the bad thing to happen, and knowing that it can affect literally everyone around me, including myself, actually.
Thank you very much. Kevin?
Yeah, I think everything that has been said is very recognizable. I also agree that issues related to the family are important drivers of fear, anxiety, and stress factors at the moment. For example, in my situation, we are with 2 caregivers at home and we have 3 young children. So in Belgium, tomorrow we will be in lockdown for 4 weeks. Actually, the lockdown started at the moment when the situation in the hospital was still very well under control, and that for me made the impact and the psychological, mental, and practical impact for my family during the first week of this lockdown now 4 weeks ago, the most important issue. We had huge problems to keep able to let my wife go to her work, and having babysitters for the 3 kids full time. That's really an important issue, which gave a lot of stress. And we really struggled with that for a few weeks before we found a solution. On the other hand, things that can facilitate, it's a very stupid, easy thing, but when you make long hours and your wife is alone at home with 3 kids and you cannot go shopping with 3 kids since it's prohibited now, there are some really stupid practical issues where I think some hospitals really have done their best. And for example, we are offered in our hospital grocery delivery services, so we can go outside the working hours and get our stuff here in the hospital itself. And I think also from this practical point of view, I feel sometimes that I have more problems telling these personal problems, which everyone would think it's normal to share these concerns. And now, since we also face important other problems, sometimes I even feel reluctant to express my concern about this, but I think it's human. And I think also there for a lot of us, especially your oncologists, there will be a huge impact also on the family. And I think the choice Matteo made is very brave, but should be very difficult to cope with. And we hope that the situation in the near future will change quickly so we can set everything. But 4 weeks, it's quite a long time to be already in a lockdown. So I don't know what's your opinion about this, but first week you can forget about a lot of things, but now we feel that it's already been a while.
Right.
Emergence.
Does anybody else live in a country that has a lockdown that can comment on this?
Yeah, like Italy is on lockdown. Also, it's a month now, so it's more than 4 weeks. And this is very very difficult again, especially from a psychological point of view. Unfortunately, we are not really allowed to have sports activity outside, so this is something else that is actually impacting myself a lot. Like I can see from my terrace, the beach is very close. It's 100 meters from where I live, but unfortunately, I cannot even enjoy it because it's forbidden to access it or to run along the beach. This is something I used to do before. We cannot go out, of course, with friends. I'm not seeing my family. So, I mean, this is very difficult from a psychological point of view, as I've mentioned. So how to cope with that, I really don't know. That's why I'm really looking forward to know what Cristiane has to say. What I'm trying to do is actually to try to concentrate on what I'm doing, because I think that as physicians, so we decide to do this job because actually we want to do something for people. I choose to become a medical oncologist for a real specific reason, so it's what I want to do. But nowadays, I'm also a physician, not doing only cancer care. So I mean, I have to do something more, and I think this is very important to accept. We have to go through that, and we have to accept that we have to do something more to people because it's what we decided to do in our life. But like on a personal level, what I try to do as soon as I have some time off, like I don't know, half day out of the hospital, a weekend not on duties, I really try to forget as much as I can about COVID-19. So not having access to social media or to a TV channel discussing about COVID-19, and people are trying to call me and discuss this issue when I'm at home and off. I really stop them, and you will know very well that I do that because
it happened a few times.
Because if I'm one day off, I really need to get this thinking out of my mind for a day, and this is very important because I feel the day after, even though I go back to the hospital with the same problem, I really feel relieved, and I really feel that I had some, that I relaxed a bit, especially into my mind and inside my mind. And I think this is very important.
Completely agreed. Ben, something to add? Ben, you're muted.
Now?
No, now we can hear you.
Yeah,
You.
perfect. Sorry. So what Matteo and Katrhin alluded to, what I found very stressful is that we see this catastrophe unfold in real time. And since we're stacked, so you had China first, and then it came to Italy, and we are seeing in different countries what is going to happen, or most likely going to happen. So everyone is bracing for impact. I have a lot of friends in infectious diseases, so my parents, who are approaching 80, have been locked away for far longer than the official German lockdown, because I was scared. So I told them most probably 6 weeks ago to start social distancing. So that this has been very stressful, I believe. And the other thing is that I'm always asking myself, when I really call a patient in that I want to see in my outpatient clinic, do I put this patient at risk? Is it really necessary to see someone right now that I wouldn't have even thought about? I would see them on a weekly or a 2-weekly basis, and now I'm debating, do I have to see them every 3 weeks or so? And that is really stressful for me, to leverage putting my patients at risk by calling them into the hospital, and exposing them to myself because I could be positive, haven't been tested yet. And on the other hand, then I'm saying, well, how much can I go away from my original routine as trying to be as close to my patients as possible? So this has been really stressful for me. Coping mechanisms, fortunately, as Katrhin pointed out, in Germany, we're still allowed to do sports outside. So I haven't been running as much as lately. So this is helping. But yeah, I mean, then you go back to your apartment and you're alone, and it's all COVID again, I would say.
Completely right. Yeah, Ben. One of the things I just it just always jumps out at me whenever I hear that phrase, bracing for impact. I think it's even in the language that we use. I don't know what it means for most people, but I think for any doctor, it's we have flashbacks of things that we have not endured yet, but everything that our Italian colleagues endured. And I don't think that there's anything scarier to me as a doctor than that phrase, because I know that it's something that can come at any time. Matteo's a dear friend, so we have spoken before precisely on this, not to talk about anything else, just what it was like. And it was that phrase, bracing for impact, that really struck a chord with me. So now I will just bring out the person that we've been all waiting for, Cristiane. Hold on. Before that, can we have NJ, please?
Hi, I just want to share something, and I think crying has something we have to talk about. I think sometimes we feel not comfortable by it because we are the doctors, we are the physicians. Our patience scenes are very strong. I have to say, I have cried in my office. I don't cry sometimes in front of my patients because they see me as a pillar. Sometimes I cry in front of them. But I think having lost so much control with the pandemic has been very difficult for many of us. My husband is immunocompromised, so I have to do this whole thing before I come home. I think half of my neighbors have seen me undress and getting dressed again. So I think crying has something we have to talk about. It is normal during this process. And I think it doesn't make us any weaker. I think it just makes us stronger, and that it can be a coping mechanism, but I have cry, I have laugh, and I have cry again all the same day.
Yeah, Thank you, Anja. Cristiane?
So yeah, I think so it's also part of my last talk here today, but I think there are multiple ways to answer to these questions, and I think we just have to keep in our minds that we are different. So we use different strategies to cope, and we use even different ways to cope with all this kind of situation. So for this question, I'm going to talk more about ways to personal deal. I'm going to focus more on our practice, and maybe at the end of our talk, I will give more details about ways to personal deal with this situation. I think it will be at least more easy for everyone. So please, Matteo, maybe I will just answer all your questions at the end. It was just like the way that I found more reasonable to present all this information. So I think generally speaking, if you think in our practice, in the oncology world, we as a healthcare providers, we have developed strong skills to break bad news. We are somewhat prepared to discuss about sensitive subjects with our patients and with caregivers, and even to deal with the consequence of it, as Narjust was saying about crying, or some of you talking about exercise or eating more, or even doing different activities to find a balance between all these stressful situations. However, for sure, it's never easy to discuss about prognosis or treatment response rate or hospice, and even about emotional symptoms. And nowadays, even about COVID, I think to break this news with a patient talking about COVID and their metastatic cancer, it's something that it's really hard. But and for sure, we are definitely are not like a cold heart, despite it's something that we are developing over the years, but we are still trying to be in touch and connected with our patients. So, but in fact, in our journey, we are always trying. So when we see a patient before COVID, and we have like some difficult conversation with this patient, and then we go back to our home, usually we have like some ways to do not bring all this kind of stuff to our family, and even to our social relationships. So I think some of this research that we have developed previously, we can use nowadays, and we should use nowadays, because this will definitely be the easiest way for us to cope at this moment. So we must use all this research during this COVID-19. And I think, and also trying to find a balance between all this risk precaution and all these new guidelines and new orientations to protect us and to protect our patients, even while we maintain social distance. I think we have like different ways to try to break all these difficulties that we are facing right now. And I know for sure it is not something that it's easy, and sometimes it's something that is easy to say, but I can definitely tell you that all of us and all of you have all this research and have all this response inside of yourself to try to manage all this kind of situation. So at the end of my talk today, I will try to bring some approach. So which approach we can use during all this circumstance, so we can for sure try to put some in practice, and maybe to see if there is like any benefit for us.
Excellent. Thank you very much, Cristiane. Okay, then we can, if there is nothing else, we can move on to the next and final part of our discussion, which is ways to personally deal with the situation. Cristiane, if you want, I can take the first one, so that you, or would you like to go first?
Whatever. I think
yep.
Whatever it's good for you.
Okay, I will just give a very slight thing. One of the things that I really just wanted to share with everyone is something that we do at our clinic, and that is something that is called the Lint groups. These are groups that were made by a British psychoanalyst. It was created for clinicians to talk about their encounters and reflect. So the way the Blink groups work is that you have a leader or a facilitator, and then you have a group of around 8 to 10 people. They could be doctors, nurses, counselors, psychologists. Always good to have a psycho-oncologist in the group, or a psychologist. And then what happens is that when you have, which we all have, but right now I think we're facing specific situations that are more stressful than our normal day-to-day. So when you have these situations that are really stressful in your life, what you do is you come into your group, and then as the first person, you present your case. And this is not a clinical case. This is actually a case of how it actually affects you emotionally and stressfully. You present it for maybe 15, 20 minutes. And then when you're done, you back yourself away from the conversation, and the group of 7 to 8 people discuss it among themselves. Of course, there's no negative feedback. This is not a time for criticism, but it's just a way for you to see how other people would deal with that same problem or that same situation. And then once that's done, you can come back into the situation or into the discussion and partake and see, okay, how would people do differently? And this is actually something that has helped me along many years because it not only shows you that there's other people out there that are willing to understand your situation, but also that maybe the way you are handling the situation is the right way, even though it feels very strange. So right now in the area, in the days of social distancing, we have Zoom, which is the way that we're doing this roundtable, and this is a really good way to get people around, a really good way to call friends that you work with, or not necessarily friends. They could be just a group that you form. And even if you don't have a psychologist, most places have a psych-onc in the team. So it's something you can talk to them. But even if you can't, it would be really good just to get it out in the open and just to get it out. Cristiane's going to be talking about different techniques of getting it out. And I think that's the most important thing, is that whether it's done vocally or in any other way, that it comes out of you and you share it with people. So that was one of the things that I really wanted to mention, because it has made a tremendous difference in my life and how I deal with with oncology, but it really strikes a chord when it comes to COVID-19. Cristiane?
Yeah. Oh, thanks so much. It was very nice to have like this input. I think it's a very good like strategies to deal with this hard situation. I would say that we are really navigating a public health crisis together. And I think it's really natural to feel a loss of control that increases our stress and our anxiety. And for sure that being front lines and treating patients with COVID-19 or even on quarantine have a significant effect on our mental health. So all challenges that we have highlighted here today and also discussed just emphasize how the COVID-19 is causing a major disruption in our lives. I think the experience that Matteo has shared with us, just like it's one example of how this can be very harmful. So we can predict symptoms of acute stress disorder, anxiety and depression, and we can also expect a long-lasting emotional burden. We have some preliminary research on COVID-19 in China, showcases high rates of mental health issues, including depression, anxiety, insomnia, and distress, which are much higher in nurses, women, and those on the front line. So in this scenario, I would say that mental health cannot be an afterthought in coping with this pandemic. And it's really important to have in our minds that the well-being and emotional resilience of healthcare workers are a key component of maintaining essential healthcare service during the COVID-19 outbreak. So this is also a key component to help our patients to better cope with this period of uncertainty. So we should use different approaches to deal with this situation. I would firstly say that we have to know more about what our patients are expecting from us. And understanding and recognize their own needs will allow us to know exactly how to help them to cope with this pandemic. So this, for me, it will be the first step. And thinking on that, the Kidney Cancer Research Alliance, the KCCure, has launched a survey study to understand the impact of COVID-19 on anxiety in patients with renal cell carcinoma. And in summary, we identified that patients have significant anxiety related to COVID-19, as we were expecting. But most of this anxiety
Okay, it appears.
we try to find ways to give more information for these patients, and also to explain or give like any better notion or a future schedule for them to count and to have a better sense of what is also associated with lack of information. And curiously, a great proportion of these patients doesn't ask their providers about their fears or worries. As I think Narjust has pointed in the very beginning, that patient doesn't share what they are thinking, and even if they are having concerns or any doubts. So we really should try to understand with them what is going on. Another point that is associated with their anxiety is financial consequence of this crisis. And patients are also afraid to do not get appropriate medical care for COVID-19 due to their previous metastatic cancer diagnosis. So they think they will not be considered as a high priority if they need anything from the healthcare system. So another approach, and I think maybe more focus on our personal life, I would say that as a healthcare provider, we must monitor and access our mental health and well-being. We must, as we suggest to our patients, so we should do with us. So we must acknowledge and recognize our own needs during this crisis. And remember, if stress persists for longer than 2 to 3 weeks and interferes with functioning, we should consider participating in formal mental health care treatment. And another approach, we should consider the need for preventive measures. And we can use some self-care tools that matches with our own personality. And for example, we can seek out and share some social support. We can also checking in with other colleagues to discuss our own experience. I know that some of you are already doing something like that. We also look for some supervision and some collegial support. We can schedule time off work for gradual reintegration into personal life, something that usually connect us with ourselves, that can make easily this transition between our work and our personal life. Maybe also prepare some worldview changes that may not be mirrored by others in one's life. And we must avoid some negative coping strategies, such as use of alcohol, illicit drugs, or even excessive amount of prescription drugs. We also should avoid suddenly making big life changes or keeping too busy to do not think about it, and viewing helping others as more important than self-care, or even not wanting to talk about work experience with others. We really need to share, and we really need to learn how we can best share our thoughts and even our experience. This is really important. I think what Gil just brings out one suggestion, and I think this is a really powerful suggestion. So a fourth approach, I would also suggest to use some research that we have nowadays in the internet. For example, we have like the guided meditation. And there are many apps based on mindfulness intervention that can be viewed and downloaded from the Android and Apple App Store. Most of those are free to use, so we can share with our patients, or even we can share with our family. I would suggest one that I'm more in touch with this group is the AIM mindfulness, is AM mindfulness. And it's clinical validated digital therapeutics that it's currently available in English, in Mandarin, in Deutsch, and in Germany. And also previous study has shown that participants reported less anxiety and depression after participating in a 4 weeks intervention. And it's something that we can do like maybe just 3 or 4 times per week, and just between and spend like 20 or 30 minutes in this app trying to do some exercise. If this match with the way that you usually cope with your situation, I think it's something that we should use. We also, most of you also mentioned some physical activities. It's perfect. I think it is one that is really important, and that help us to create a balance between our emotion and our rational side. Music therapy, so listening to music, those that really bring us some peace or bring some good moments, it's important. Or even the expressive writing. I think Narjust mentioned that she's writing. I think it is really a good way to deal with it. Sometimes just like write what you're thinking, and then you can like just throw away. I would not suggest you to keep this as something to record or something to reread. It is something that you are just trying to put in words everything that you are feeling. So it doesn't matter if there is any sense. And please don't read this again, or don't give this or share this with anyone. It is just a strategy for really put this out. So all of this approach and all other ones that you were using, like cooking and what else, can help you to regain a sense of control and can for sure reduce some anxiety. And we know that if we are doing great, if we are feeling good, our family will probably feel in the same way, and our patients too. So we are a very important piece in this situation. Other than that, I've just reviewed, and I saw that there are some programs available for patients and for healthcare providers that you should ask about these programs at your own institution. Just as an example, I've talked with Dr. Mao, and he and his team at Memorial in Katrhin are offering some classes for patients and healthcare providers. I think for healthcare providers, it took just like 15 minutes. And some of these classes are available on YouTube. They also have like some suggestions how to do some exercise at home if you are not able to go outside, and to do some physical activities. And before our meeting, I've discussed it with him, and he told me that if we identify there are needs, they for sure can develop something for non-Memorial Sloan Caring employees. So maybe we can like try to see if there is like, if this needs is real. I truly believe so. And maybe they can also try to open this for other ones around the world. And finally, if you think you need a treatment, please remember that you can search for some telepsychology or telepsychiatry options, and even medications if needed. I saw that in China, they are with some open lines for patients and for providers. So I really believe that this is also available in Italy and also in other countries. If you reach me, I can try to search using our group to see if anyone knows. Now we have like a very large group with psychologists from different parts of the world, so they sure can connect you with some important resource. And finally, and just to summarize, I would acknowledge that mental health treatment is not just something that happens urgently or in crisis, but rather is something that needs to continue and be available long into the future. And please take care of yourself.
Thank you so much, Cristiane. See, this is what we were all waiting for, this moment of enlightenment. So thank you so much. Really appreciate it. Katrhin?
I think most of the coping strategies were already somehow mentioned, but what I realized after like 1 week into the lockdown is that on bracing so much for what's going to happen, I somehow forgot that I needed contact outside of the hospital world and outside of my own flat. So in the beginning, we postponed our meetings with friends, and then there was the lockdown, so we couldn't meet anymore. And then like just 1 week ago, we decided to have like a virtual meeting, and we met with our girls group in Zoom, and everyone brought a glass of wine, and we had like our social meeting we usually have in some of our flats in front of the screens. And although it was not the same, I think it was so helpful for every one of us, because despite not being a normal group meeting, it was just an evening together, and we could talk about all the problems we talked about before COVID, everything that just was busy in our heads apart from the pandemic. And I think that's something we should bear in mind, that we have like contacts outside of the hospital and outside of this crisis that are still there, and we have other problems too, and we can talk about them as well. And all the good things that might happen as well, we can talk about them, and we should talk to people outside of this, outside of our working surroundings, because they are still there. And for me, this evening was like one of the most helpful events during those last weeks, because it was, yeah, so normal. It was just a normal girls' night, although it was not a girls' night out, but it was a normal girls' night somehow. And I think that's something we should bear in mind, that this contact to our friends is something we should proceed despite of social distancing, because we have to distance like in meters or whatever, but we can stay emotionally close, and that's something we should proceed, I think.
Completely right. Thank you, Katrhin. NJ?
So I want to, sometimes this may feel like it's going to break us. Since sometimes this crisis may feel like it's bigger than us, but we are oncologists. We overcome many challenges during our career. And I know at this time it may feel like we can't, but deep inside my gut tells me that we will. Like, we are built for this. We encounter crisis every day with our patients. So I'm hopeful. I'm prepared, but I'm hopeful that we will overcome this.
Thank you, NJ. Okay, well, with that being said, any parting thoughts from our discussants? Matteo, can we take you first?
Yeah. So, well, I share all what has been said so far. I think that, of course, we will succeed that, and we have all the energy and the strength to do that. So, yeah, I mean, this is something that what I always tell people is that I really hope that we will learn something from this experience on all aspects of our life, professional, personal, and yeah, on all aspects on our life. And then if in a few months from now, we'll just remember this period as a very difficult one, but that teached us something to improve the way we live, and also we take care of our patients.
Absolutely. Thank you, Matteo. For me, and a lot of my friends have been affected, not only in Italy, but Germany and a lot of different countries. And it's not just a physical thing, it's a psychological thing. And as I mentioned, this is the reason that we did this, to try to bring back the focus on our mental health and our families, because it's very important. So we wanted to let you know that you're not alone. We're all feeling it. We're all here, even though, I mean, you can reach out to us, but I'm sure you have people that are closer. Reach out to them, reach out to your workers. We belong to the biggest family there is, and that's the healthcare worker family. So just reach out to the people, because I promise you that they're feeling the same things that you are. And like Katrhin mentioned, programs like Zoom are amazing. I don't know if you've noticed that in social media there have been a lot of there's been a lot of work, not only by institutions but also by societies. ESMO and ASCO are working on it, and even ESMO now is working with the OncoAlert network. We're working with the Resilience Task Force from ESMO to do surveys focusing on mental health, to try to understand it a little better. This is a long project. This is not a one-time thing, but with the COVID-19 pandemic, we just couldn't close our eyes, and we have to tackle it. So it's something that is being led by Susanna Banerjee, and it's a great project. But perhaps, Kevin, can you tell us a little more about it?
Yeah, thanks, Gil. I would love to. Yeah, it's in the regard with the idea that we can really help each other by sharing our coping experience and sharing initiatives that improved our personal coping. And it's in this regard, actually, that the Resilience Task Force from ESMO, in collaboration with the YOC, with the Women for Oncology, LGP, and of course, OncoAlert, we worked out a survey the previous 10 days with really the goal to have first, at the moment, a snapshot about several COVID-related issues, such as changes in a professional situation, well-being, and coping during the current wave of the pandemic. But we also will have further surveys among oncology professionals during and post-COVID-19, really with the goal to explore also a little bit the longer-term impact of COVID-19 on burnout and well-being. So actually the survey is finished now, which should be released within 1 week from now on. And it will be sent out to all ESMO members by mail, but it will also be offered by social media platforms, and it will be open to every oncology professional, not limited to oncologists, and also including non-ESMO members. So I would really like to recommend to everyone to take some time when you see this survey pass by to fill this in. And so we really hope that with the information we receive from you, we will be able, as the Resilient Task Force in collaboration with these other organizations, to help you better with that.
Thank you, Kevin. And just one of the things to mention, the reason that this came about last week at our roundtable, I put out the call out there to any society that wanted to work with us, especially regarding the COVID-19 pandemic, because we really want to do our share. And of course, ESMO heard our call, and we're very happy that things move so fast. We do this because we really believe that we can help our colleagues that are definitely going through a very tough time. ESMO feels the same way. So I think this is something that is going to be good in the long run. Ben?
Yeah, I just wanted to strongly echo what Matteo and the others have said. Yes, this is a disastrous time, and I don't want to be too optimistic and say, well, always look on the bright side of life, but I guess we're going to come back stronger here, and there's still in these times things that you can learn about yourself, about your surroundings, and that will make a positive impact once we overcame this. And what I really, really like about the situation is that you see solidarity that we haven't encountered before. I mean, we all work in very competitive academic surroundings, and dealing with the whatever. And anesthesiologist on call has never been easy at night, but out of a sudden they just jump in and help and put themselves at risk. So I mean, this is really inspiring, and I sincerely hope that we will be able to have a little bit of that transferred into the life that we will have after COVID-19.
Exactly, Ben. And if you think dealing with the anesthesiologist in the middle of the night is tough, trying to come up with what you're going to eat for dinner. It's tougher. My wife is an anesthesiologist, so so that's the thing. We can't lose our sense of humor. NJ said it best. You cannot let this beat you. This is something we're going to pull through. We're going to get through it. But we have to smile. and we have to remember that there's plenty of life worth living. So keep at it. Meis?
Yes, so the situation is not as bad as I've been listening to you all, and it's been very helpful to maybe look up front about what's coming up. But I would like to point out that sometimes good things can happen as well, because at least in my hospital, it's never been working so smoothly before. I mean, we see collaborations between different specialties, and all people are really being trying to help each other. So I hope that this will continue even after the pandemic, and because it's been really, really good in some places.
Thank you, Meis. Katrhin?
So I think most of the important things were already said, because I just can share my experience on the COVID ward. Usually it's really difficult at night when someone deteriorates to get an intermediate care bed, to find someone to help you. But right now everyone's working together, and I think that's something that makes me optimistic that we are going to get through this somehow. And I think what Narjust said is so right. We can feel hopeless and we can cry, and that's okay, I think. But in the end, I think we can get up again and say, okay, we do this together, and we do it because, like, I think what we heard here is that we can tackle crisis, and we do this every day. So we're going to tackle this crisis as well, I think, and it's going to be hard, I guess. But in the end, we'll somehow manage, and that's what I am taking home from this roundtable, because that's what the general spirit is, I think.
Absolutely. Thanks, Katrhin. Felipe, anything you would like to add?
Yes, just a moment to open my audio. So I was taking random notes of words here that you just said. And now that I'm reading the words, I'd like to share with you things that we have said here. So in the beginning, we started with a lot of COVID-19 resources, priority, medications, cope, and the ward. And then in the end, we come up with words like solidarity, physical activity, music, optimistic, free, good. So I think maybe it will be in that way that we're going to go through all this crisis. Now we're seeing the hardship of what it is to be in the middle of this pandemic. People are very scared. I include myself. I'm super scared. I'm afraid of dying because I have pulmonary conditions. But I'm pretty sure that our hope that we improve as a human species after we finish with all the story of COVID-19, and that we stay strong and we improve as human beings. So thank you for being here and to make part of these discussions.
Thank you very much, Felipe. Yeah, no, absolutely. The human spirit is exactly what is allowing us to get through it, and I think it's a human spirit that allows for collaborations like this. You're all here because you want to help. You're all here because you have something to say, and we really appreciate the fact that you took the time to come out and talk to us, especially right before Easter. This is a time where we're normally going to a family or traveling somewhere, and it's tough to not be able to do it, but we make sacrifices, and we make sacrifices for the greater good. So this is wonderful that we're coming together, not only as a medical community, but even our neighbors that are not in the medical community. They're keeping their distance. They're following the right recommendations, and that's great. So to wrap us up, I just wanted to give Cristiane Bergerot the last word.
So yeah, I would say let's keep working as a team. We are a team. We are in this together, and we for sure can try to help each other to better cope with all this stuff. Sometimes something that it's easy for me, it's not easy for you, or vice versa. So we for sure can try to work and to find the best way to cope and to pass through all this situation. So yeah, you're a team. Let's go.
You're mute.
All right, there we go. Sorry about that. Yes, so thank you all very much for doing this. And with that, I guess we can wrap up this third round table. Thank you for making it a great success. Thank you for giving your testimony and for giving people out there a little bit of an insight of what it's like in our psyche. So thank you very much. I hope you all have a wonderful Easter. And be safe. All we have is each other.